Welcome to TMJ Unpacked, a podcast where we explore jaw pain, facial pain, and sleep through an interdisciplinary lens. I'm Dr. Natasha Nagpal, a dentist focused on craniofacial pain and dental sleep medicine. Whether you're a patient searching for clarity or a clinician looking to think differently, you're in the right place. Now, today's episode is a very special one for me. I have my mentor as a guest on this podcast. That's Dr. Carly Jacobs. Um, and this conversation is going to be a very personal one for me. I first met Dr. Jacobs when, we were working together in a corporate setting and she was leading the sleep team there. At that point in my career, I was still trying to understand where I fit, what direction I wanted to go in, and what kind of dentistry I really wanted to practice. And just being around her, watching how she thought, how she approached patients, how she connected the dots between sleep, breathing, and pain, it actually changed something for me. It made me start seeing things differently. And if I'm being completely honest, a lot of what I do today, the way I think, the questions I ask, the way I look at patients beyond just their symptoms, has been shaped by that experience. So, in many ways, she's a big reason why I'm here today. Dr. Jacobs now actually runs her own successful practice focused on TMJ and dental sleep medicine in Pennsylvania and brings a really thoughtful and interdisciplinary approach to patient care. So I'm really grateful and really excited to have this conversation with her today. Um, Dr. Jacobs, welcome. I'm really, really
Thank
glad
you.
to have you here.
Yeah, thank you. I'm so excited to be here with you.
I think one of the biggest assumption we've all been trained with is that if someone isn't snoring and they don't have obvious signs of sleep apnea, their breathing and sleep are like probably fine. But that's not always true. Why do you think that this belief is so deeply ingrained in how we've, been trained?
Yeah, it's just thinking back and with my training in dentistry and my residency, we never talked about the importance of sleep ever. And as I started, doing this years ago, dentists are in a really great role to be screening for airway issues. I mean, the signs are in the mouth when people have an issue, and you don't have to snore, you don't have to stop breathing in order to for there to be an issue. Mouth breathing is an issue. And so understanding that if someone is mouth breathing at nighttime, that alone is affecting your quality of sleep. So for me, I'm trying to get to people when they are at that stage before it progresses, to snoring or to obstructive sleep apnea.
I agree. I think even like I'm just talking about primary care physicians, like our PCP visits. No one ever talks about sleep unless it's actually obvious. No one talks about if you're breathing well. So it goes to a point where it's really advanced before we even start looking at sleep and breathing issues.
Well, that's so right, because if you rely only on the answer the patient is giving you, you're missing a huge piece. Like, for example, if you're asking, "Do you snore?" Someone says no, so then you're just like, "Okay, their sleep is fine. There's no need for a sleep test." So you have to be the one not just asking the questions, but really investigating. Is there something else going on that the patient doesn't know that really could be driving their pain, or for us, their TMJ issues?
Do you feel like the traditional model of diagnosing sleep issues really falls short? Where does it fall short?
Yeah, so even if you just look at a very standardized like sleep screening form, which is the stop bang, if you really look at the questions, it's really meant for the males who are over 50 who are at a certain weight. So if you're just using that screening form, you are missing the females, the low BMI, people who are not obviously obstructing. Um, so you really have to look outside of these standard, like traditional screening surveys that are being used out there.
What is one like screening questionnaire that you really like to use and that you recommend?
So, I mean, I do for, insurance purposes and, kind of like collaborating with my medical colleagues. I do use the stop bang. I use the Epworth sleepiness scale. But then more importantly, I just look at the health history, and even just looking at the health history, even if they don't have any sleep issues, there's a lot of things that could be screaming that they have an airway issue. And those are like not the typical symptoms that people look at when they're screening for airway issues.
So when I practice, I have a lot of patients who don't come in saying like I have a sleep problem. Uh, who is that patient for you? Who you feel is most commonly missed when it comes to breathing and sleep issues.
Yeah, for me, when I started treating, TMJ disorders, and then I really started to look at how these patients were breathing and what they were doing at nighttime, the amount of patients that had this underlying breathing problem that nobody else even looked at, that was huge for me. So those are my typical, high majority of them, high percentage are my female patients of all ages, but these patients have been suffering for years. They've been clenching on night guards, they've been breaking night guards. Their symptoms are progressively getting worse. And the root cause of a lot of these patients that I see are really what they're doing at nighttime, like their breathing. So it's really something that I screen every single patient that comes in my practice. I'm looking at their breathing and their airway. And sometimes for them, they're like, why are you why are you looking at this? Because I sleep fine. But then when we start to educate and we start to just get a home sleep test, by the way, they're very easy to do. And they tell us a lot of information about how someone's breathing. Every single patient has always said, "I cannot believe that I had this issue because I felt like I slept fine." So that's really a big chunk of my patients that really don't fit the model of having like an airway issue. So a lot of my pain clenchers and grinders that I
Yeah.
see.
I've
Mhm.
been lately, I've been seeing these younger patients who don't fit the typical profile. They're in their early 20s. What I've seen is skeletal issues. I've seen like class 3 skeletal pattern, open bite, low tongue posture, resting tongue thrust. And they present with jaw symptoms, they present with headaches. And the interesting part is that no one's ever talked about airway or sleep. So never had a conversation, but their anatomy is presenting that they have like a sleep issue. Yeah, that's what I feel like. These are the atypical patients that I've seen in my
Mhm.
practice. Yeah.
Well, I'm sure it's interesting when you see a patient and they have literally seen every single specialist out there, and not one person recommended a sleep test. And it's not us bashing other providers by any means, because every neurologist, every ENT that I've connected with and I've kind of talked about airway, they're like, oh my gosh, I had no idea. And so then it's about working together. And just helping, like, providers just talking to each other so then we can help patients better together. So,
And have you seen like some signs that don't like scream that it's a sleep issue, but should actually make us pause as a clinician and see what they are?
yeah, I mean, I do see a lot of my patients. I know I'm talking a lot about females right now, but it can affect males too. But I see a lot of anxiety, a lot of, depression, a lot of like almost like patients are stuck in like this sympathetic state because their nervous system is like upregulated. And, a lot of these patients understand, what's happening, and they're really trying hard to like, meditate, do yoga, but the problem is stemming from what's happening at nighttime that's then moving in towards like how they're feeling during the day. So I would say biggest red flags for me, um, anxiety, depression, morning headaches is a huge factor that I see a lot. And then just light sleepers. Like I hear a lot of people will say, I I sleep like 10 hours, so I'm a good sleeper. But then when you start asking questions, well, like, do you feel like you wake up like often, like to noise? And they're like, oh yeah, I'm a light sleeper. So sometimes people don't understand that like it's not the amount of time you're sleeping, it's about the quality of when you are sleeping. And that light sleep is actually not a restorative sleep for a lot of these patients. So once again, it just comes down to like education about sleep.
Yeah. What are the symptoms you see all the time that people tend to normalize, but they really shouldn't?
Well, I going back to snoring, and I talk about that because we have normalized snoring in our society. And, we kind of make jokes about it, like it's common for, oh, my dad, he snores like a bear. But really, snoring is a huge issue. If you really think about what snoring is, when you're sleeping, the air that's traveling through your airway is trying to make its way through a small opening that it's causing the tissues to vibrate. So that alone, think about what that's doing to your body. So I am on a mission to like really tell people and change the way that we think about snoring. So, mhm.
When you have a patient saying, I'm just tired all the time and labs are normal, nothing stands out, how often is sleep is a missing piece there? And what does that actually look like in real life when it actually gets missed?
Yeah, so I think that, for me, I think the biggest piece and I do get a lot of referrals from, like, functional medicine doctors. To your point, they're testing everything. They're working on hormones, they're working on other factors that absolutely can be affecting sleep, like your vitamin D levels, things like that. But what I get patients referred to me because nothing's really working or sticking. So then what I look at is anatomically, like what's happening, the size of their jaw, like how much tongue does their space have in the mouth. It does matter with how big your airway is. So as you know, we look at the airway size. If someone's had a smaller airway versus the larger airway, that all matters. So for me, I'm looking more at the anatomical piece of it. And then once we really address that, then they start to notice that the other things that they're working on really comes together.
Yeah. There is this group of patients that I actually really find fascinating. It's like the ones who don't meet the criteria for sleep apnea. Um, they don't feel well. They're tired all the time, all the classic symptoms, but they don't have sleep apnea. What's actually happening with these patients physiologically?
So if you imagine someone like sleeping and let's just talk about a patient that does not have sleep apnea. Let's just talk about someone who is mouth breathing at nighttime. So our nose is the only organ that can warm, moisten, and purify the air that we're breathing. And it actually puts your body in a parasympathetic state. So rest and digest. That's the way that you should be sleeping all night. However, if someone's mouth is falling open, and when you think about mouth breathing, people have this idea that your mouth has to be completely open, saliva falling off the side of your mouth. But in fact, it's just any air that is able to get past your lips. So that alone, your body will recognize that as like an emergency, like mouth breathing is an emergency. So then your body goes into a sympathetic state, cortisol is released, heart rate is spiked, and all of this can happen without even having an obstruction. So that's why I talk about could it be just these patients are just not breathing well, not that they're obstructing, but they're mouth breathing. Like we have to get the air through the nose. And so there's different ways to do that. But once we can switch patients to nasal breathing at nighttime, they just feel so much better. Their quality of sleep is better. So sometimes it's just about switching certain habits, or as you know, you have to make sure that there's nothing in the nose that's preventing them from breathing well. So a deviated septum, inflammation, do you have to work with an ENT, for that? We have to look at the nose as well.
Yeah. I know we've talked a little bit about women. Uh, there, do you feel like they're missing more of these sleep and breathing issues in women? Uh, and what does a non-classic presentation look like to you?
Well, for me, a non-classic would be, obviously we talked about they're usually not the snorers, they're not gasping at night. I would say waking up repeatedly though, I do see that a lot and people kind of not make excuses, but they kind of think it's happening for other reasons, whether it's mothers with their kids or they have I call it secondhand sleep apnea from their bed partners. So that could be waking them up. To go back to your point of just education, that it's not always the environment around you, it's actually what's happening inside. And a lot of that stems from the airway and how you're breathing.
I've been seeing lately a lot of women on anxiety and depression medications, and they have not slept well for years. Um, for me, that catches my eye, and the only thing I feel is when I'm actually working with patients is that they've been put on medications, but why didn't anyone talk about sleep and breathing? And that like kind of puts me into a position where this should have been done earlier for women.
I do see a lot of patients that have been put on like sleep medication. And if you have an underlying, anatomical problem, that's actually making it worse. So that is something that I see a lot.
In my practice, I see patients for like jaw pain, headaches, facial pain. Um, and out of 5 patients I see, I think 3 of them have a sleep issue. How often do you see those symptoms actually being driven by underlying sleep and, breathing issues? And what changes when that piece is actually addressed?
I would say similar to you, like out of 5 patients, I'd say like 3 of them, there's like a clear sign that there's an airway component going on. So I always tell my patients that I'm definitely going to address your pain and your TMJ issues. And there is a chance that I could actually get you sleeping better, even though a lot of these patients, like to your point, they don't always feel like there's an issue. But if I know that there's an underlying issue, even if the patient's not ready to kind of talk about it or address it, I know that part of my treatment, I'm going to get them breathing better at nighttime. And what I start to see throughout treatment is that these patients are like, I actually feel more rested, or because you get used to kind of like your normal. You've learned to compensate until you really feel what it's like to actually sleep well. Kind of like someone who can't see, they put glasses on for the first time and they're like, "Oh, I guess I couldn't see." So that's very rewarding for me, and that happens, oh my gosh, a lot, and that's what keeps me doing this because it's, how it is. It's so rewarding to see that. And a lot of the times it's about just having the patient go through treatment to experience it for themselves, and then they become an advocate, for someone else. Yeah.
Was there a patient or a case that really changed the way you think about sleep and breathing?
Oh my gosh. I a lot of the patients. I think I'm constantly learning from my patients, and that's why I'm so excited to do this, for the rest of my career, my life, as long as I can work, because it's just every patient teaches you something. And the moment you think you know it all, I always say you need to stop practicing because there's always more out there to learn. But really, what got me kind of into this, I mean, years ago when I was in general dentistry and I just started dabbling a little bit in sleep appliances and I was treating patients. I was just doing it. And I was helping so many of these patients that had obstructive sleep apnea and just getting them not obstructing. So they're feeling better. And then I know that I'm really helping them like be healthier, live like a Yeah, and so it was just a different part of dentistry that I just wanted more of it, which is why we left general dentistry to do this full time. Yeah.
If someone listening does not have any classic symptoms, what would you want them to take away from this conversation?
I would say that sometimes it's just good to maybe just even get a sleep test, a home sleep test, but as you know, there's different types of sleep tests. There's some that only looks at do you have sleep apnea or not. There's other ones that can really look at, other things as well. I think that the home sleep tests, they've come a long way over the years and they're really easy to take. So sometimes just like starting there just to see like, hey, how am I breathing at nighttime? Because I always talk about how we live in a sick care world. We really don't live in like a healthcare where we're trying to prevent things. We have to wait until someone actually has symptoms in order to treat them. So I always say look for someone in your area that will look at the airway, we'll do an airway screening just to kind of give you more information. You don't have to be in pain, you don't have to have all these crazy symptoms just to have an evaluation of how you're breathing.
What's one symptom people tend to normalize and that really shouldn't be normalized?
Oh, there's so many. I mean, I think fatigue is a big one. Fatigue is so rampant in our society from just like what I hear all the time is like, oh, I'm fatigued because I just work a lot. I work long hours, things like that. But if I could give like at least a piece of advice as well for someone to kind of like start doing and thinking about is it's about awareness. So I tell my patients throughout the day, check in on yourself. And I want you to focus on two things. One, is your mouth truly closed all day? Or do you get what I call like air hunger, where you do bring air through your mouth throughout the day? And the amount of patients that come back to me, they're like, oh my gosh, I had no idea the amount of times I actually had to breathe through my mouth. The other thing is how often are your teeth in contact? Because a lot of people, we're in the TMJ world, so we have to, talk about proper habits. So are your teeth in contact during the day? Are you walking around holding tension on your teeth? If you are, as easy as it sounds, you just release your teeth. And then over time, your body will kind of get into that habit. So I think another thing that we normalized is, tension. A lot of people hold tension in their jaw and they're just like stressed.
Yeah.
Um,
Yeah.
and a lot of it's like multifactorial, like the amount of times for each patient I'm collaborating with one of their other doctors,
Mhm.
which I love that. That's the way that we should be treating patients is, working together with other providers.
This is such an important conversation because not every sleep or breathing issue looks obvious. And sometimes the patients who are struggling the most are the ones who are the easiest to miss. Thank you so much, Dr. Jacobs, for being here. And if you are listening and something resonated with you, it might be worth looking a little deeper into your sleep and your breathing. This is TMJ Unpacked, and I'll see you in the next episode.